Hello everyone, my name is Dr. Aishwarya Sinha, aka Dr. Pencaster, and I am here with my first ever tutorial video on the topic pulse. Now before we get into any detail regarding this topic, let us first find out why is it important to measure pulse. Well, just by measuring pulse, we can find out the general condition of the heart. This is especially important in emergency conditions where it gives us an idea whether the heart is able to pump sufficient blood or not. Sometimes it also helps to point towards the cause of certain symptoms such as shortness of breath, dizziness, fainting attacks, and irregular or rapid heartbeats known as palpitations. By measuring the pulse, we can also check the blood flow after an injury. For example, a fall injury which might have led to a fracture, be it internal or external fracture. And by palpating the blood vessel near the injured site, we can know or ensure that the blood supply to the distal segments are intact. This is also true in cases of injury caused by sharp objects. Other than that, it also helps to check on medications and diseases that cause the slowing of the heart rate. And lastly, of course, it also gives us an idea of the general condition and fitness level of the patient. As we all know, it is one of the vital signs of life. Going over it again, the importance of pulse rate gives us a general idea of the heart's functioning, the cause to certain symptoms such as shortness of breath, palpitations, etc. Helps us to know the blood flow after injury, check on medications or diseases that cause the slowing of the heart rate, and also gives us the general idea of fitness level of a patient. Now let's move on to the definition of the pulse. What is pulse? Pulse is nothing but a palpable pressure wave felt in the superficial arteries. Now, these superficial arteries, as we all know, the superficial temporal, common carotids, the brachial, radial and ulnar arteries, femoral artery, popliteal artery, anterior and posterior tibial artery, dorsalis pedis, and so on. Now, in order to palpate for the pulse, we must do so against a bony prominence. And this palpable pressure wave that we are talking about, this pressure wave is mainly created because of the ejection of the blood from the left ventricle into the systemic circulation. To be more precise, the ejection of the blood into the systemic arterial circulation. So this is the definition of the pulse. Pulse is nothing but a palpable pressure wave. This wave is created because of the ejection of the blood from the left ventricle to the systemic circulation, and these waves could be felt in the superficial arteries against a bony prominence. In other words, we can also describe pulse as the elongation and expansion of an artery, or the elongation and expansion that can be felt in an arterial wall due to the column of blood in it. The expansion and elongation of an arterial wall which is produced by the column of blood that is present within it. And this expansion and elongation is mainly created by the pressure changes during the ventricular systole and diastole. That sums up the definition of the pulse. Before going into any further details, we must know what is the normal pulse rate. The normal pulse rate is in between 60 to 100 beats per minute. Moving on, whenever we talk about the pulse, we must describe the pulse under certain headings, namely, there are 8 headings under which we must describe the pulse. Those are the rate of the pulse, rhythm, character, volume, the radio-radial delay, the radio-femoral delay, the condition of the arterial wall, condition of the arterial wall, and I missed the other point. The 8th one is the palpation of peripheral pulses. Peripheral pulses. Now we will talk about the detail of each of these points. The rate is mainly how frequently pulses are occurring. Now we spoke about the normal pulse rate, which was 60 to 100 beats per minute. Now if the rate of pulse drops below 60, that is known as bradycardia. Pardon me. And if it goes above 100, that condition is known as tachycardia. These words are Greek in origin, where bradus means slow, tachys means fast or swift, and cardia is pertaining to the heart. After rate comes rhythm. Rhythm is nothing but the spacing or the gap that comes between two heartbeats. This spacing may be regular or irregular. Spacing between two heartbeats. Character I will deal in my next video because this is a long one, a long topic, and we must know about this point in detail. Volume refers to the amplitude of a pulse wave or excursion felt at the wrist. It is the amplitude of the pulse wave. In other words, it is the perceived degree of pulsation that reflects the pulse pressure. The next one, the radio-radial delay and radio-femoral delay are mainly felt by palpating both the radial arteries simultaneously and checking whether the pulses in both the radial arteries are coming at the same time or whether there is a gap in between the two. Similar way is to palpate the radial and the femoral artery in order to check for the radio-femoral delay. The condition of the arterial wall is especially important while measuring the pulse of elderly patients or people with complaints of with hypercholesterolemia. Because in atherosclerotic walls, the condition of the arterial wall may become thickened, and that could be noted by palpating it using the trisect method. Again, the details of all these points will be dealt in the next video. And peripheral pulses is especially important and it needs to be palpated in people with peripheral vascular diseases. Hope you liked my first video. Please like and share your comments down below. Thank you.